3 yoga poses that you can do at home, and it's super easy, but it gives really nice release. Prolapse is a descent of pelvic organs like bladder, uterus, or bowel through vagina or anus. It is very common after pregnancy, and many of us have it. It can be asymptomatic, or there can be symptoms like pressure bearing down onto your vaginal canal, abdominal pain, lower back pain, incontinence, especially urge incontinence, difficulty emptying bowel or bladder, and of course it can be depression after all as a result. But I want to tell you that the cure is there. You can heal. Many women don't know that, but there are tons of different exercises and movements that you can do to help. Hi Mom, I'm Katerina. I'm postnatal yoga instructor, and I specialize in mom's health and holistic approach to healing. We're going to start with laying down on the floor in a constructive rest position. Okay, so your feet will be flat on the floor, and you can have your arms open, or you can have them over your head to open the rib cage, or really wide open. It's up to you, however feels comfortable for you. And this time we're just gonna breathe. We're gonna start with breathing. So you inhale through your nose, exhale through your mouth, but the rhythm of your breath is normal, okay? And just notice how your pelvic floor and your core, like the whole abdominals, react on your inhale and your exhale. And see if you can feel the relaxation of your pelvic floor on your inhale. So when you inhale, see how you let go of any contraction or any pressure or any tension in your pelvic floor. And keep breathing. Breathe normally. Let's take a couple more breaths. And from here, I want you to shift your attention on your rib cage and see if you can feel when you're inhaling and your rib cage expands. And it expands sideways, front and back. And you really feel the breathing going through your rib cage. So focus your attention there. You can place your hands like I am on the rib cage if you want, or you can keep them open to allow your rib cage expand and allow oxygen to go in. And the next thing what we can do, we're going to you can slide your heels farther if you need. Dorsiflex your ankles. So just dorsiflex your ankles and keep breathing. And see if you can feel the contraction of your pelvic floor on your exhale. So remember, when we inhale, pelvic floor and everything is relaxed. But on your exhale, your diaphragm goes up and your pelvic floor goes up too. You might feel slight contraction in your pelvic floor. See if you can add up to it. See if you can feel the contraction on your exhale. But we're not squeezing it. We're not squeezing the pelvic floor. It's not Kegel. We're just activating it on your exhale. And on your inhale, you relax. Let's do a couple more times. Inhale, everything's relaxed. Exhale. Have slight contraction of your pelvic floor on your exhale. Inhale, relax down. Again, inhale, everything's relaxed. Exhale, activate your pelvic floor and the core. Inhale. So now let's place your feet back on your floor. So feet are flat on the floor. And from here, place your feet together and your knees close together. And what we're going to do is, we're going to, on your exhale, you're going to open your knee on the side. But your right knee, well, my right knee, your right knee, stays still and strong. Inhale, you bring it back. Again, exhale, release your knee on the side. Imagine that you have a glass of water on top of your right knee so that you don't want to spill that water. So you keep it strong and steady. It's your left knee that is falling on the left. Gently, of course, slightly and gently. So inhale, you bring it back. Exhale, relax your left knee on the side. Inhale, bring it back. Now let's do the same on the other side. So exhale, relax your left knee on your side. Right knee on your right side. And your left knee is steady. Imagine that glass of water on top of your knee. You don't want to spill it. Bring your right knee back. Again, your right knee, exhale, it goes down towards the floor. Inhale, bring it up. Again, exhale, move it down to the right side. Make sure you don't overstretching it. You're not stretching it. You only go as far as you can go. No need to stretch here. We're not doing any stretches. Let's do one more time. Exhale, leave your knee on your right side. Inhale, bring it down. Connect to your breath cage breathing again. So you inhale here. Focus on your rib cage breathing. Exhale, activating your pelvic floor. Inhale. Exhale. So now take your, expand your feet a little bit wider, as wide as your hips. Okay, so hip width distance apart. Next one, and it's your last exercise, our last pose, would be bridge with the pose between the breathing. Now, if you're pregnant, I don't want you to do any poses in your breath, so you just breathe normally, okay? If you're not pregnant, you can do the pose with me, okay? So we inhale, everything is relaxed. Exhale, remember that slight contraction in your pelvic floor as activation your pelvic floor and your abdominals. Inhale, relax. Exhale, activate your pelvic floor. Now start with the tailbone. We're gonna go all the way up, not too far up. So your scapulars are still on the floor. And exhale, relax down. Again, inhale here on the floor. Exhale, lift, activate your pelvic floor and lift your pelvis off the ground on exhale. Now here, inhale here. Exhale, going down. I'm exaggerating my breath so you can hear it. Inhale here. Exhale, lift up your pelvis up. Now here, before you inhale, pause. So you pause your breath here and you lower your pelvis down. Now inhale here. Exhale, lift up your pelvis. Before inhaling, pause and lower your pelvis within that pose. Inhale on the ground. One last time. Inhale here. Exhale, lift up your pelvis up. Pause your breath and lower your pelvis on your pose. And now inhale. Now last time, exhale, activate your pelvic floor inner core and lift up your pelvis. Now don't do any poses here. So you just inhale, exhale as normally. So we're just staying in a bridge pose. So pelvic floor is activated on the exhale. Inhale, relaxed. Exhale. Inhale, relax. And on your exhale, you're going to lower your pelvis down. Inhale here. You can extend your legs if you like. This is the end of our practice today. Inhale and imagine your ribcage expand. With every breath in and out, you feel how your pelvic floor, the whole pelvis and abdominals are relaxing and dropping all the tension. Now I'm gonna leave you here. If you have opportunity to stay relaxed, do that. Otherwise, you would bend your knees and roll on your side. Take a couple of breaths on your side. And then push the floor away from you to lift yourself up. All right, so this was very easy and very quick. So you can do these 3 movements. And I really hope you have a time to practice it today or tomorrow in a consistent basis, of course. Let me know how you like it, if you like it, if you tried, if you didn't try it. Comment below. I would really appreciate your feedback, and I'll see you next week. Bye.